Um, 2008, since 2008, we've been much achieved the best to palliative percutaneous surgical care of metastatic bone cancer. I made a unique screw and nail for percutaneous fixation and simultaneous bone cement injection. We published 10 necessary journals about these clinical outcomes. I think we'll have an opportunity to share of these methods in the future. Yes, today's story is 3D printing in bone tumor surgery. Recently, corona pandemic situation, you may see 3D printing technology related to medical equipment.
Yeah.
Look at this 3D printing respiratory belt and face guard, even container. My first case started 2016. 23 years old young man had a calcaneal tumor. I designed it considering many factors, including mechanical stability, postoperative wound problem, future adjacent subtalar arthritis. He was in Air Force military duty service at the time. Yes, Korea had a mandatory military service period over 2 or 3 years. 3D printing calcaneal reconstruction was successful. The Korean FDA approved 3D printed orthopedic implant just before this case. However, it had been used on skull and dental area from 2014 in Korea. When you choose limb salvage surgery than amputation, we have to reconstruct a bone defect area. Tumor process is the most common used method. We have just one company product from Germany. Even that, only major joints are possible, and there is nothing imported for growing children. Ortho graft and allograft are also frequently used method. As you know, limb salvage surgery has really many restrictions and complications with a long operation time. Can you see my feet, bloody feet, and my child appearance? As you know, this is a pastoral autograft. It's a reusing method. Tumor burn soaking in 65 degrees water for 30 minutes and refix it. The problem is too weak. The allograft should be selected similar size, needs shaping by hand and metal fixation. It also time-consuming procedure and too weak in the end. The pelvis is the most good indication of 3D printing surgery. She has been suffering from bilateral breast cancer and left hip sarcoma during over 20 years. She had no breast on both sides, so she hoped to keep her leg in this time. Actually, I recommended amputation several times. Yes, there are many considerations to optimize the 3D printing output for each patient. Fixation with ilium, total rib curve conjugation, and so on. 3D printing pelvis hybrid with the total rib process and femur allograft. At this first pelvic case, I realized the difficult to cover assembly at a small operation field, and also it was time consuming to connect with the iliac bone using a long screw. So next case, I designed the 3D acetabulum as exactly same screw holes of a 50 mm real acetabulum curve. It made much reduced surgical time because we could pre-assemble it outside of OP field during the surgical approaching. The 3D implant weight is much reduced with a mesh-style body. Look at this transmitter light through mesh body. This is ischium. It does not roll in weight bearing, so we omit ischium. In this case, we also omitted the pubis, and body has reaches to deepening of corkscrews hole. The original corkscrews, 16, 20, 25 millimeter, we can be used without Helichrys cutting. In the periacetabular tumor, 3D printing implant designed with a gap for bone cementing. It will make it easier when we need attaching acetabular cup in the future. The 3D printing pelvic spacer can be fixed with just bone cementing without a screw fixation. We can carve out like cavity resection without navigation or X-ray fluoroscopy, and also custom-made cavitary reconstruction easily by 3D printing technology. We can much transform the original bone shape for reduced complication and better functional outcome. Like this downside iliac crest problem. Up to now, there was no special way to reconstruct the external genitalia pubis without complication. The 3D printing pubis prevent herniation, maintain the sexual activity, and enjoy favorite sports. This is a acetabular reinforcement ring. It did not fit to patient and made worse the abscess site nerve irritation, eventually bad reading. The 3D acetabular reinforcement curve was the good solution. Yes, our orthopedic oncology team is like a family. The scapula is also a good indication like a pelvis. The KFDA does not yet approve 3D printing articular surface on major joint. Therefore, we should combine with the total shoulder arthroplasty curve. I designed it to enable both surgical method, conventional or reverse shoulder arthroplasty, by depending on the assembly pieces. I've been trying to reconstruct the humerus in children with these many different methods: process cement, process allograft, IM nailing, osteoarticular allograft, and IM nailing, and bone cement. Now 3D printing humerus is available. So far, the available metal print output is limited to 20 centimeters in length. So process joint and 3D printing body combination was needed. This is Mutal's proximal humerus and 3D printing implant combination. Previously, partial elbow joint was reconstructed with an osteoarticular allograft, but it had been destroyed. 3D printing partial elbow joint implant was successful. 3D printing forearm bone reconstruction was attempted. In this patient, we had two removal of 3D ulna due to local recurrence. This patient is a fibromatosis patient. you may see surrounding soft tissues firmly attached. The meshed bone contact surface showed advantages for bone integration. His second surgery was a failure due to insufficient fixation. I designed the 3D printing connector between the 3D radius distally and ulnar bone proximally. It was designed in a functional posture to right. The 3D printing segment of femur looks stronger than allograft, and we conjugated it with the intramedullary nail for more stable ablation. Two-piece server 3D printing cortical mesh makes easy application, good soft tissue adhesion, and prompting cortical bone bridging in the femur shaft surgery. These 3D printing custom-made plates are useful in some areas like adjacent knee joint. This is a fibrous dysplasia patient who has severe bone deformity and pathological fracture. Using 3D printing guide and implant, the angulation, rotation deformity, and leg length discrepancy were all successfully corrected at once. Look at this chondrosarcoma patient. She never touched her left heel by 10 centimeter longer right leg and had a big tumor on the right femur. 3D printing segment femur process was designed to correct the leg length and knee joint saving. In this patient, the metal breakage occurred during the exercise. But it looks like detached between the implant body and plate. Yeah. Then sharp breakage. Looks like detached. Stable fixation could not be possible with the conventional plate and cable wires. So this is 3D printing connector between the 3D printing processes and remained femoral bone. Successful surgery keep a knee joint and correct varus deformity angulation. This patient had pelvic surgery with a saddle process 20 years ago and showed the process avoid migration and difficult to hip flex sit down. 3D printing revision implant made him good walking with the restoration of hip motion. The allograft pelvis eventually breakage, osteorized, and hip dislocation occurred. The 3D printing implant designed in 2 blocks. The block selectively used according to the surgical field situation. By the car accident of 2 years ago, this patient had 20 times hospitalization and 11 times operation. The left pelvis had 5 times surgery. But she could not walk and heard there was no muscle anymore by hip surgeon. Not tumor. But she came to us National Cancer Center, and our 3D printing experience helped her walk again and go back to the job. Not only 3D implant, we proved the usefulness of 3D printing tumor resection guide and 3D printing allograft shaping guide as well. 3D printing is a conversion to study many processes. So we need close collaboration with each professional team. So far, we have published 8 clinical and research papers. This is a 13-year-old male who received a biopsy for pathologic fracture tibia at the regional hospital and transferred to me and diagnosed with adamantinoma. I had the surgery with a 3D printed implant within just 1 week of visit. 3D printed implants are now becoming one of the methods of limb salvage surgery.